Welcome to Women's Health, the OBGYN podcast. I'm your host, Alexa Economos, alongside Dr. Griffith with Health Central Women's Care. Dr. Griffith, it's so good to be here with you today. The first question is, and I guess I feel a little silly asking this, but I think if I don't know, then probably a lot of women don't know. What exactly is endometriosis? We hear about it all the time, but I don't know that I fully understand exactly what it is.
Endometriosis is a condition where the lining of the uterus or the endometrium implants outside the uterus in the abdominal cavity. The endometriosis implants can be on the back of the uterus, that can be on the ovaries, it can be on other organs such as the appendix or the bowel and the abdomen, and that can cause severe pain. It also can cause infertility. It can cause scar tissue that can lead to damage of the internal organs, what we call adhesions between the organs, and also lead to cysts on the ovary, which can be painful. It is a very common cause of infertility and a common cause of pelvic pain in women.
So most likely, if a woman has endometriosis, she's going to have something nagging at her to some degree.
Most women will have some discomfort during their period, increasing pain, or come to the doctor because they are having difficulty conceiving. However, some women can have relatively no symptoms or no symptoms with endometriosis, and that can make it difficult to diagnose.
So a couple of scenarios. First of all, if a woman is having a hard time getting pregnant, infertility, at what point should a woman, or I guess at what age group? Is it 6 months? Is it a year? If you're not getting pregnant, that you should maybe start to think maybe it's endometriosis. What are, I guess, the parameters we're talking about?
The traditional time for treating, for getting a evaluation for infertility has been 1 year of not being able to conceive despite trying. However, many people are now seeking advice and an evaluation sooner, usually around 6 months.
So if I were to come in and say, I think I have endometriosis, how exactly would you evaluate me?
So the diagnosis of endometriosis can be difficult. It can be, it frequently isn't thought of as a primary problem for most women. So the doctors have to be cognizant that could be the actual diagnosis. So the first thing to do is to take a good history and to find out about pain, difficulty getting pregnant, difficulty and pain with intercourse, painful periods, pain between periods. Those are the most common things in the history. And then there are some laboratory tests and evaluations that can be done that can point you in the direction of endometriosis. However, the actual diagnosis can be difficult to make.
Can you catch endometriosis on a sonogram?
In certain cases you can, and in certain cases
really
you can't.
Yeah.
What usually will lead you to believe that there's endometriosis on a sonogram is cysts on the ovary. And those are visible. They're not viewed as a simple cyst, but what we call a complex cyst. You can also see the ovaries out of place on a sonogram, which can lead you to think that there's scar tissue, and that's a possibility. However, many women with endometriosis will have no evidence on sonogram.
So if, let's say, for example, my mother had endometriosis, would that be something I would worry about? Is it hereditary?
It's not directly hereditary. However, there is a tendency toward it in certain families. So if you had other family members, sisters, mother, who had endometriosis, it would certainly be something that should be considered.
Yeah. Another reminder that it's so important that we know our family's health history. And sometimes families aren't always forthcoming about that. You really have to be armed with that information. A thing that a lot of women worry about is the possibility of cancer. Can endometriosis cause cancer? Or is there any kind of a link?
Endometriosis is not commonly associated with cancer. However, women who have endometriosis, especially in the ovary, can develop an endometrioid cancer in the ovary, usually later in life. However, malignancy is not the primary concern of younger women with endometriosis.
That specific kind of cancer you were talking about, how difficult is that to treat if that were the case for an older woman?
As with any ovarian cancer, it can be aggressive and deadly in many cases. So women who have any suspicious mass in the ovary at an older age would need to be surgically evaluated.
Okay. So what are the forms of therapy or treatment for endometriosis if a woman does get the diagnosis?
The first thing with endometriosis is to get an accurate diagnosis, which can be difficult and frequently isn't thought of. Mainly you need to do a history and physical first, and then appropriate evaluations including sonogram, possibly a blood test called a CA-125, which is actually an ovarian cancer blood test, but is frequently elevated to low levels in women with endometriosis. So I will add that test in frequently, and if it's in the 50 to 75 range or even slightly higher with evidence of a cyst on a sonogram in a young woman, I would frequently think of endometriosis as a possibility. That test measures inflammatory response in the abdomen and can be very helpful with that. However, the absolute diagnosis of endometriosis is usually made by laparoscopy, which is a procedure where you look through the umbilicus into the abdomen and can directly see endometriosis implants.
And that is surgery?
Yes, that's a surgical procedure,
Laparoscopic surgery.
usually a day surgery procedure.
Wow, okay. So once you've gotten to that point as a patient, there is a form of therapy called elagolix. Is that what it's called?
Yes, elagolix is a new product which was just recently approved by the FDA. It is similar in action to Lupron, which has been available for the last 20 years. It is the first new treatment approved by the FDA for endometriosis since Lupron in the last 20 years. Traditional medical treatments have not been very effective in the past and have had significant side effects.
So if someone were to do the elagolix therapy, is that in the pill form? What exactly would the routine be?
Elagolix is a product that is what's called a GnRH antagonist. The previously used product, Lupron, was a GnRH agonist. So they're similar in action.
What does that mean exactly, like layman's terms?
So in layman's terms, what those products do is decrease the brain and the pituitary gland from producing female hormones, specifically estrogen and progesterone, which can be similar to menopause type-like symptoms, which can decrease the growth, since there's no hormonal stimulation, the growth of the endometriosis.
And you were talking about side effects. If someone were to go on this therapy, what kind of side effects might they expect?
So the traditional Lupron therapy over the years has significant side effects. Most women with that will have no menses. They will have significant hot flashes, mood swings, irritability, and with long-term use, they can have loss of bone or changes tending towards osteoporosis. So most people do not recommend treating with Lupron, which is an injection, past 6 to 9 months. Elagolix is a newer product, but similar. It has similar side effects, but not as severe. Most of them will continue to have light menses. There is less effect on the bone, although there is some. The therapy is oral instead of injection, It can be used for a longer period of time, and it is available in 2 different doses for treatment of acute endometriosis, and then a lower dose for chronic treatment of endometriosis.
What would the cost of this be?
The cost is similar to Lupron. Both products are expensive, and that's been a major concern for people. Elagolix is priced in the same range as Lupron, which is going to be in the thousands of dollars.
Wow. Okay, in the thousands. And what would the effect be on pregnancy? Can you do this if you're pregnant, or if you're trying to get pregnant?
Both products are recommended for women who are trying to get pregnant and before they attempt to conceive. However, neither product is approved for use during pregnancy.
Okay.
So these are products that you take to rid your body of the endometriosis, to treat the endometriosis before you're ready to conceive.
So can a woman just have laparoscopic surgery to get rid of the endometriosis? Or does it just continue? This is stopping the hormones from producing more?
The usual course would be to have a laparoscopy and an evaluation of your pelvis. If there's endometriosis cysts in the ovary, to drain those, to remove any scar tissue that's formed laparoscopically, and to either remove or cauterize endometriosis implants seen laparoscopically. Following completion of that, there may be small areas of endometriosis left, or there may not be.
Okay.
So you would, at that point, treat with Elagolix for several months to prevent regrowth of endometriosis, or to get rid of microscopic implants.
Do you find in most cases, or perhaps the numbers are not really clear to see, but in most cases, do women have to go on this kind of therapy after having it surgically removed? Is that pretty much the reality for the majority?
The majority
patients?
of women will take either Lupron or Elagolix for a short period of time if they have significant endometriosis found on laparoscopy.
Okay. Well, thank you for explaining that. There's, I think for a lot of women, a lot of mystery surrounding endometriosis, and we certainly appreciate you shedding more light on it today. Thank you, Dr. Griffith.
Thank you.
For more information about Dr. Griffith and endometriosis, you can visit Health Central Women's Care at healthcentralobgyn.com and also on social media with the handle @HealthCentralTX.